Good afternoon and welcome to the coronavirus webinar, Resources for Child Care and Advice from the Field. I'm Kiyomi Harris, the Director of Learning and Events here at Child Care of America. Today is a very important webinar and we know that you will have many questions. So please use the questions box instead of the chat to ask your questions. Our goal is to answer as many questions as we can, and those that we aren't able to answer during this webinar, we will compile and work to get you the answers. You will receive an email with a link to a resource page, which includes the recording to this webinar. Leading us today is Lynette Fraga, the Executive Director of Child Care of America. Lynette began her career in early childhood as a teacher in infant, toddler, and preschool classrooms, and she has held positions at local, state, and national levels within nonprofit, corporate, and higher education sectors. She earned her doctoral degree in family studies from Kansas State University, a master's degree in human relations from the University of Oklahoma, and a bachelor's degree in special education from the University of Arizona. Now I'd like to turn it over to Lynette.
Thank you so much, Kiyomi. Good afternoon and good morning to our friends on the West Coast. Welcome to our coronavirus webinar for child care resource and referral agencies and child care providers. More than 4,300 people have registered for this webinar. I want to first acknowledge that we are in such a very difficult time, and our best thoughts and supports to each and every one of you. We are all in this together. I am very pleased to be joined today by Julie Luper-Coates, the Director of Child Care of America's Emergency Preparedness and Response Team, Jessica Rosemom, our Senior Health Policy Manager, and Steve Rohde, Deputy Director of Maryland Family Network. As you know, many working parents across the country are scrambling to find alternative child care arrangements as schools and some child care providers have closed. This crisis has demonstrated just how important our work is, from the child care resource and referrals that help parents find child care, to the child care providers who are enabling healthcare workers, first responders, and many others who provide essential services to stay on the job, even as providers are facing their own difficult decisions about whether to stay open. We have been hearing from child care resource and referral agencies and child care providers that they are looking for information and resources to help deal with the challenges posed by the novel coronavirus and its impacts. We also have been contacted by the media and policymakers about how the coronavirus is affecting child care providers. They want to know what's happening in communities across the country and what providers are doing to prepare and protect themselves, children, and families. We are monitoring all of the ever-changing information and recognize the many different situations that the child care field is facing. Today, some of you are facing shutting down centers, and many others of you are looking on the horizon, seeing what's happening around the country, and need to know how to prepare for any eventuality. Our goals for this webinar are to share the latest coronavirus and emergency preparedness resources from Child Care of America, along with updates and advice from our staff team. In addition, we will facilitate a discussion of what's being done around the country at child care agencies and what people are doing to prepare and work and support families. We encourage you to submit your questions and comments at any time through the chat box on GoToWebinar. I'd like to provide a brief policy update. We anticipate that child care providers will need additional support. While this is a quickly evolving situation, we're listening closely to the needs of providers and hope policymakers will as well. Last week, Child Care of America joined coalition partners on a letter urging Congress to provide significant and dedicated funding for child care programs during this public health crisis. In addition, CCAoA and partner organizations have asked the Office of Child Care to provide guidance to states about the flexibility they can offer under current law. The Office of Child Care provided guidance late last week. A link to that guidance is available on our website. The first federal emergency spending bill included additional investment in the Small Business Disaster Loan Program, which providers may be able to access for low-interest loans. In addition, agencies and partnerships with states are taking action to ensure students out of school can still receive food support. On March 14th, the House of Representatives overwhelmingly passed an economic relief bill that includes paid sick leave for some workers and money for food security programs. The Senate is considering that bill this week. More efforts like this will be needed, and lawmakers must consider policies that support the health and safety of all of our families and communities, as well as address the economic issues faced by child care providers. Child Care Aware of America has prepared policymaker recommendations, which are also available on our website. In addition, Congress needs to hear from all of you about the importance of providing dedicated support to the child care system and stimulus bills that they pass. You can use our Digital Action Center to share this message with your legislators. Now I'd like to turn it over to Jessica to provide the latest health guidance for child care providers. Jessica?
Thanks, Lynette, and thanks to all of you for joining us today. So much of what we're seeing, hearing, and feeling about the coronavirus pandemic feels unsettling. And please know that we're all feeling it. But now's not the time to panic. It's the time to prepare, to be vigilant, and to do all we can to prevent the spread of this deadly virus. Next slide. I want to preface my comments with a really important note. Information about coronavirus is changing fast, and the status of the outbreak varies considerably state to state and community to community. The health and public health experts in your state and your community are the best equipped to give you information about how to stay safe. We'll be sharing our current guidance from the Centers for Disease Control and Prevention, but I want to encourage you, if you haven't already, to visit your state and local health department and early education department websites, to sign up for their text or email alerts, and to make contact with your local child care health consultant. These are the folks that can give you the most appropriate guidance for issues like whether or not to close your program and when to reopen if you have to close. Next slide. To give a little background, coronavirus is a fairly common type of virus that can cause coughs, colds, and fevers. Like the influenza virus that causes the flu, there are different strains of coronavirus that can make people sick. Most of the strains are familiar, meaning people have been exposed to them in the past, and many people are immune to them. Sometimes a new strain of the virus emerges that people have not been exposed to before. That's what's happening with the coronavirus this year. Because this strain of the virus is new, more people are getting sick, and we don't have a vaccine to prevent it. This new strain of coronavirus spreads mainly from person to person when an infected person coughs or sneezes. The tiny respiratory droplets they exhale can be inhaled by others or land on the mouths or noses of people nearby. They can also land on surfaces and spread when others touch those surfaces and touch their own eyes, nose, and mouth. Next slide. The respiratory illness caused by coronavirus is known as COVID-19. Some people who are infected may not show symptoms at all. For about 80% of people who come down with COVID-19, the illness they experience will be mild, usually cough, mild fever, and fatigue. Some may experience body aches, runny noses, similar to cough or the flu, or cold or the flu. But for about 20% of people who get COVID-19, they'll experience a more severe form of the illness that causes shortness of breath, high fever, and pneumonia, and requires hospitalization. According to the World Health Organization's most recent estimates, about 3.4% of those who contract COVID-19 will die, although the rate varies significantly based on age and overall health risk. As of about 4 p.m. yesterday, there were 4,226 total cases of COVID-19 in 53 U.S. states and territories, including 75 deaths. Next slide. We don't all face the same risk when it comes to how severe this illness can be. Children seem to be experiencing much milder symptoms, which feels like a real relief for those of us who have children in our lives. On the other hand, older adults, particularly those over age 60, are much more likely to experience a severe form of COVID-19, requiring hospitalization. The same is true for people who smoke, people with chronic health conditions like lung disease, heart disease, and diabetes, and for people who have compromised immune systems due to cancer treatment or immune suppressing medication. The risk of severe illness, hospitalization, and death is much, much higher among those populations. So even though the children in your life may not be at high risk, your parents, your coworkers, neighbors, and you yourself may fall into the higher risk category. Next slide. As you know, the situation and the recommendations for how to respond have been changing quickly. Currently, the White House recommends avoiding social gatherings of 10 or more people, although whether this recommendation applies to childcare is not entirely clear. If your state or local public health department tells you to close, you should do so. Julie will go into more detail about CCR&R of America's recommendations around closing programs shortly. As of now, we know that many childcare programs are still open and still figuring out how best to keep their staff, students, and families safe. Next slide. Thankfully, childcare providers are experts when it comes to hand hygiene. Children and staff should wash their hands with soap and water for at least 20 seconds when they arrive in the program, before and after meals and snacks, after bathroom breaks, and before and after outdoor play. You can use hand sanitizer when soap and water aren't available and when hands aren't visibly dirty, but make sure that it's at least 60 to 95% alcohol in order to be effective. Proper cough and sneeze hygiene is important too, so remind children and staff often that they should be coughing and sneezing into the crook of their elbow and wash their hands immediately afterwards. The CDC has posters on hand washing and cough etiquette that you can print out that can be helpful visual reminders. We also want children and staff to limit touching one another. Instead of hugs and high fives, work on greeting one another with a fun dance or a silly movement that doesn't involve physical contact. You can also reduce physical contact and exposure to coughs and sneezes by taking children outdoors as much as possible. You can try holding your circle or meeting time outside in a standing circle in the classroom, on the playground instead of in the classroom. You can also work on creating habits and reminders that help everyone remember not to touch their faces, which we know can be particularly hard for young children. If they forget, just make sure they wash their hands afterwards. Another really important note on hygiene is around food. Try to limit food sharing among children and among staff. If your program uses family-style dining where children serve themselves, consider suspending that practice for a while and having staff members with gloves do all of the serving. Next slide. Childcare providers are also expert cleaners, so it's important to keep up those good habits and be even more diligent about your cleaning routine right now. Caring for Our Children Online recommends following a routine schedule of cleaning, sanitizing, and disinfecting, and they have extensive information about procedures for doing so. So I would encourage you to visit their website. It's also important to make sure the cleaners you're using are effective at killing coronavirus on surfaces. We have a list of EPA-approved cleaners available at the CCAoA coronavirus resource page, so you can go there to make sure that you're using an effective cleaner. Ventilation is also critical, both to limit the spread of the virus and to air out areas where you're using those cleaners more frequently, so kids and staff aren't breathing in all the fumes. Next slide. The final big preventive measure that you can take is making sure that children and staff stay home when they're feeling sick and when they have a sick person in their household. You should have a standard policy for when children and staff need to stay home already, but make sure that it includes symptoms like cough, fever, and shortness of breath. These symptoms may be more stringent than the ones that you usually use, but now's the time to use extra caution. If you don't already do them, consider implementing daily health checks for children and staff when they enter your program, which could include taking temperatures as they enter the program. That will allow you to catch those who need to stay home early before they get into the program and allow you to monitor changes in health throughout the day. That second piece about staying home when you have a sick person in your household is very important and probably not something you've done in the past. You'll need to make sure that families are aware of this rule and why it's important. You don't want a child to spread the virus even if they're not showing symptoms. And you don't want family members who are sick coming into the program for drop-off and pickup. Family members who are over the age of 60, have chronic conditions, or compromised immune systems should be discouraged from dropping off and picking up whenever possible. And if you have staff members who fall into any of those high-risk categories, they should stay home as well to protect themselves. Next slide. So I also want to mention social distancing, since it's a term that's gotten a lot of attention and it's a really important public health strategy for keeping communities safe. Social distancing is exactly what it sounds like: staying out of public places, avoiding large gatherings, and staying at least 6 feet away from other people when possible. In your program, that can mean staggering the times that staff and students enter and exit so there's less crowding. You may also consider having a staff member greet children at the door of your facility and bring them to their classroom instead of having family members come in and out. You should also cancel any visits from outside guests like music teachers or guest readers. Obviously, social distancing extends beyond your program and into your daily life as well. Even if we don't get sick ourselves, contact with others can help spread the virus and help it reach more and more vulnerable people. We need to protect ourselves, our loved ones, and our neighbors by taking measures that may seem inconvenient or drastic, but now's the time to do it. Some examples of social distancing include stocking up on food so you can avoid trips to the grocery store, avoiding public transportation, canceling events like conferences, birthday parties, and play dates, and avoiding public spaces like the gym, library, or playground. To make a meaningful difference in slowing the spread of the virus, CDC recommends a strong effort at social distancing for 8 weeks. And one of the things that's a big concern with this disease outbreak is that hospitals will be overwhelmed. We want to make sure that hospitals and doctors are focusing their time and attention on the patients most in need of medical care. If everyone who has a cough or fever goes to the hospital, the chance of transmission goes up. So it's important to know when you should stay home, when you should call your doctor, and when you should go to the hospital. Next slide. For a mild cough, fever, and aches, it's best to stay home and treat the symptoms with over-the-counter medication. If you're worried about those symptoms, you should give your primary care doctor a call to get their advice. Some hospitals have set up toll-free hotlines that you can call if you think you're showing symptoms and might need to be tested. Some states are also beginning to set up drive-up testing sites. Symptoms can get tested for coronavirus, but those aren't widespread yet, and you should check with your doctor and your local health department to find out if it's an option. You should also avoid going to the emergency department unless you have symptoms of severe illness, like shortness of breath, persistent pain or pressure in your chest, confusion, or bluish lips or face, which could be signs you're not breathing properly. If possible, call the emergency department ahead of time and let them know that you're coming so that they can take proper precautions. Next slide. So things feel really scary right now. We're worried about our health and that of our loved ones. We're worried about making ends meet, about making the right decisions for our businesses, and about what it all means for the future. Please, please take care of yourselves. Take a long walk, cook a healthy meal, or call your friends or loved ones. With so much that's unknown, we need to do the little things that can make us feel better and help us get through this situation together. Thank you.
Thank you so very much, Jessica. Now I'd like to introduce Julie to share emergency preparedness and response guidance and resource from CCAoA. Julie.
Thank you, Lynette. Good afternoon, everyone. My name is Julie Coates, and I'm the Director of Emergency Preparedness at Child Care Aware of America. We're in an unprecedented time. We know this situation is fast-moving, and CCAoA is quickly developing resources and guidance to help the child care field understand how to best meet the needs of families in need of emergency care. We know this is a rapidly changing and evolving situation, and because of that, we're responding to our member and provider questions as we learn new information. Next slide, please. First, I'd like to touch on what's on a lot of your minds, the potential closing of your programs or your organization to implement new guidance. Thinking about closing or being asked to close brings up a lot of questions and uncertainty. Because this is a rapidly changing situation and is also varying state to state, I want to reassure you that we hear those questions and we are learning more and receiving updated guidance. We're quickly pushing that out to you so that you're best equipped to make a well-informed decision. Another item I would like to highlight is that CCAoA is using our expertise in public policy and advocacy to raise your concerns with policymakers. As Lynette mentioned before, we've published a blog on our site with recommendations for policymakers. We encourage you to check out those resources. Lastly, I want to make sure that first and foremost, as Jessica mentioned, that you're taking care of yourself, your staff, and your program or organization. Ensuring that you're ready and prepared is critical before you can provide services to providers, families, and your community. Next slide, please. As you know, the situation and the recommendations for how to respond have been changing quickly. So to help you better understand, we've adapted the CDC's Decision-Making Guide to help you think through the decision to close your program. So I'm going to walk you through that quickly. Next slide. For all programs, if a child or a staff member from your program tests positive for COVID-19, you need to reach out to your local health department for guidance. They will look at the most up-to-date information in your community and help you assess the risk of staying open. If there's a positive case in your program, you should plan to dismiss children and staff for 2 to 5 days to deep clean, to allow the public health agency to track where that positive case came from, and to assess if and when it's safe to reopen. Next slide, please. When the initial cases were reported in the US, public health officials were easily able to track how people became sick. They've either traveled outside of the US to an area or been in close contact with someone who had traveled to an identified area. This is still the case in some areas of the country. The disease is easily traceable and it doesn't look like it's spreading on its own in the community. In those areas with no community spread yet, now is the time to prepare and stay vigilant with hygiene, cleaning, and exclusion practices. Jessica shared earlier what those practices entail, and you should stay in close contact with your state and local health departments and monitor if and how the virus is spreading in your community so you can make quick decisions if and when the situation changes. Moving on. As the outbreak grows, we start to see community spread, where new people are getting sick and they may not know how they became infected. This is the point when many K-12 schools are taking action to close and when we also recommend most child care providers close. One important consideration, of course, is that first responders, hospital staff, and other essential personnel still need safe places to send their children while they're working to manage an outbreak. If you're serving a lot of these families, it's even more important for you to reach out to your public health agency and child care resource and referral on guidance of whether or not to close. And if you do close your program, please contact your local CCR&R to let them know so that they can help families in need find care temporarily. Moving on. Child Care Aware of America recommends that when K-12 schools are canceled, so are child care programs. The exception is child care programs serving emergency and essential workers like nurses, paramedics, and public health department staff. The reason for this is to implement social distancing, in turn flattening the curve. You may have seen this graphic over the past few days. We all need to pitch in and try to prevent both cases within ourselves and in our communities. This is a term that public health officials use all the time, but that many Americans may have just heard for the first time this week. Canceling, postponing, or moving online for our work, education, and recreation is oftentimes inconvenient, difficult, or disappointing, but hospitals need to have enough room, supplies, and staff to care for those who need hospital-level care, whether it's for coronavirus or any other needs where a person may need hospital care. We know this is not an easy decision, and whether or not to close has direct implications for programs, families, and children. So we are committed to quickly developing resources and additional guidance to help the child care field understand how best to meet the needs of your community. Next slide, please. On today's webinar, we have CCR&R members, child care providers representing both centers and family child care. On these slides, I'd like to highlight some of the solutions we have heard from these varied audiences as it relates to emergency and temporary care. Yesterday, our team at Child Care Aware of America had the opportunity to listen to these members from across the country who are spearheading this work and finding child care solutions, supporting providers during this difficult time. Out of Washington State, we heard from the CEO CEO at Child Care Aware of Washington that all schools will be closed until at least April 24th and possibly until the end of the school year. You're likely experiencing similar situations in your state. And as child care facilities have closed, pop-up care is emerging in needed areas. Child Care Aware of Washington is tracking child care closures and vacancies daily and reporting those to the state. Coaching staff are checking directly with child care facilities for current vacancies and finding out who is closing. Care for first responders has been a priority for many, and as facilities have closed down, efforts are now focused on connecting displaced workers with work. Next slide, please. Next, I'd like to highlight some of the great work that's coming out of Atlanta. The YMCA of Metro Atlanta saw a need to address the child care needs of health personnel who were called to action. The YMCA is suspending their usual after-school and camp program in the area and exploring the possibility of using those resources for child care for parents that are healthcare workers and first responders. They are partnering with local hospitals to gauge the child care needs of healthcare staff and then working within their organization to accommodate the children and families needing care. This model is being tested this week, and they will know soon if they have the ability to open in all of their 23 locations by Wednesday. It is their intent to highlight this model implementation across the country. Next slide, please. Lastly, I would like to highlight some of the ways that family child care providers are stepping in to meet the needs of essential personnel, such as hospital workers. In the state of Montana, several family child care providers participate in a Guardian program that focuses on providing emergency care. The CCR&Rs throughout the state coordinate the program, which equips willing child care providers with training, resources, and support to offer care to first responders and hospital staff. MOUs are in place with a number of caregivers to meet this important need in the state. Next slide, please. First and foremost, knowledge and understanding of this ever-evolving situation is vital. Things are changing every day, sometimes an hour, so ensure you're reading, understanding, and taking sound knowledge and set guidelines. The amount of information coming in can be overwhelming, so be sure you're using trusted sources of information. Reliable, up-to-date information can be found on CDC's COVID-19 website. In addition to learning about this pandemic and how it might affect you, your agency, or your program, I want to reiterate the need to call upon your local experts. If you haven't already, establish a relationship with key healthcare and public health partners in your community. You can also monitor their website and social media posts for reliable, up-to-date local information. A health department directory for states and territories, cities and counties, and tribes can be found linked here. Next slide, please. In addition to the CDC and your local health department and healthcare systems, the American Academy of Pediatrics and the World Health Organization are also trusted sources. Look for information that is specific to child care when possible. We also recognize that the impacts from this event have a large effect on your program or your organization. As I stated before, as our team learns more, we are committed to sharing that information with you. We are providing regular updates in our newsletters and through our social media channels. We will continue to share that information with you. As for resources, and please feel free to contact our team should you have questions, need tools, or tips when working with your providers, families, and the community. Thank you for your time.
Thank you so very much, Julie. Now I'd like to turn it over to Steve Rohde to share what is happening in Maryland around the coronavirus and the work that the CCR&R system is doing to assist the child care community and families in Maryland. Steve?
Hello. Yes, I see I'm on now. Thank you. This is Steve Rohde. Good morning on the West Coast. Good afternoon on the East Coast. First of all, I want to be clear that I'm not an employee of state government and I'm not speaking for the state. But having said that, I applaud the efforts on the part of Governor Larry Hogan and the state government in putting out a strategy to mitigate the novel coronavirus COVID-19. That strategy, elaborated last Thursday and since amended, will create some short-term burdens for families and businesses, but the public health implications of this current crisis demand very specific action. We also recognize that this plan will evolve based on the needs of the community and the patterns of outbreak. I also want to give credit to Lynette and Childcare Aware of America for all the information they've shared and all the information they developed. I was part of a statewide network call yesterday that was extremely informative. It was very helpful. So my organization is Maryland Family Network. We're a private nonprofit. We have the privilege to operate through a state-funded grant, a network of 12 childcare resource and referral services. As a network, we help parents and guardians find care that meets their needs through telephone counseling and internet-based services, offer professional development in the form of training, technical assistance, coaching, and mentoring, in the form of live in-person training, webinars, and so forth, as well as communities of practice and more. Probably as you did, we began looking at this several weeks ago as we saw countries take extreme measures, including reducing travel, reducing events to have large groups, and other precautions such as hand washing, sanitizing, health screening, that we in the early childhood service field do as part of our normal practice, but obviously on an exaggerated basis now. We realized, given the nature of this growing emergency, that we would need to seriously consider different modalities of service. We also realized there would be a growing need on the part of the early care and education community to have accurate, usable information to help them better serve children and families. So a listing of what we've done, included, we assessed our technology needs in order to expand our remote services for a time of crisis. This not only included determining the equipment needs like laptops and headphones, connective needs such as internet capability, access to software and files, but also staff capabilities. We also assessed our technology inventory, working with the 12 CCRCs regarding their preparation. Since each of the 12 CCRCs in our network are independently operated and include private nonprofits, governmental entities, higher education, and so forth, we provided technical assistance and oversight and coordination to help them with their efforts. We also began surveying the information available on the coronavirus COVID-19, determining its accuracy and its appropriateness for distribution. Having done that with our new executive director, Laura Wheeldire, and her support, we're implementing, effective today, a series of practices and formats. So number one, all of MFN's services will be done remotely and virtually. This includes parent resource and referral. The telephone counseling staff have laptops and headsets to use remotely. For the phone-related function, we're using cell phones, Google Voice, and connecting it through those laptops. Training and technical assistance that can be done virtually/remotely will be done in that manner. Training that can only occur live in person has been postponed through April of 2020. All meetings will be done virtually through conference call, the Zoom platform, and other means. Those meetings that cannot be done virtually will not be held. Working with the CCRCs on providing all services remotely and coordinating those services, including things such as seat licenses or seat sharing when R&Rs are doing approved webinars, and sharing information through the Child Care Resource Centers by social media and other media, radio, webinars, and so forth. This includes not only all things relevant for child care providers, but also information for parents to help them cope with this situation. We're also working closely with the Maryland State Department of Education to help implement the governor's order expanding child care access so that providers of health care, emergency medical services, law enforcement, and other services that may be in need of child care services for their school-age children when schools are closed, they have available. We have a daily status update with MSDE, which is very helpful. As appropriate, we're putting out clarification on the governor's orders and information that child care programs need to know. We're reaching out to child care programs regarding vacancies and operational issues to assist with the governor's orders. And just to expand on this a little bit, that would include our locate staff, which is what we call our parent resource and referral services. When they're not taking calls from parents, calling child care providers, determining if there are vacancies, determining if we can refer emergency personnel to those vacancies. There have also been some very innovative approaches. So for instance, I'm working with one program in the DC suburbs, and what they've done is they've noticed a pattern with their families who are not sending children to their care settings. And what they're doing is a survey to determine how long are the parents going to keep the children out. And if the parents are agreeable, could they loan out the spots to emergency personnel in order to accommodate their needs? We're also providing information and technical assistance as child care programs are affected by, number one, the closing of public schools, since many are co-located in public schools, as well as being co-located in houses of faith when those settings have decided to close. Information on sick children and staff and protocols to put into place to determine risk, possible closure in the future should additional measures need to be taken, such as closing of childcare in general, and then modification of programs to accommodate school-age children and how we might help family childcare providers and center-based providers cope with that. And then also a drop in enrollment because preschoolers with siblings in public schools are staying home. So in addition to traditional childcare resource and referral for parents, we're also putting out information for parents on how to cope with the current situation with their school-age children at home. So for instance, we did a radio program this morning on the things you can do when your school-age children are home and not drive yourself crazy. We're already anticipating some lessons learned with this. And we think there are some lessons learned that we really do need to act on. So number one, we see this unfortunate emergency that demonstrates the importance of having available, high quality, affordable early care and education that meets the needs of families. It gives an impetus to us to return to some of the origins of Maryland CCRC Network that began and worked on capacity building, not only for things like quality improvement, but also to help people enter the system at a high level. We're revisiting the shared services concept as a support mechanism to help people in the system, as well as to establish a quality setting from the beginning of a provider's program and experience. We would do that as they enter the licensing system. Internally, we've looked at all future equipment purchases that we should have in mind the need to go remote at a moment's notice. Fortunately, this time around, we had sufficient laptop capacity for our locate childcare services, as well as for other staff needing this capability. And then finally, we recognize that there have been 5 different similar virus emergencies in the past 30 years, including 2 Ebola outbreaks, H1N1 swine flu, and the current coronavirus COVID-19. One has to realize that with our global community, with the ease of travel these days, this may be happening with greater frequency. I appreciate the opportunity that Child Care Aware of America has given me to present on this, and I'm open to any questions that anyone may have. Thank you.
Thank you so much, Steve. Now we'd like to hear from you about what's being done at child care agencies and what you're doing to prepare and work with families. We encourage you to submit your questions and comments through the chat box on GoToWebinar, and I'm certain there are many that have already come in. Kiyomi?
Thank you, Lynette. Yes, we have many comments and questions. And I just wanted to reiterate that we are going to be compiling the questions. We know we won't be able to answer all of them, and we will get as many answers out to you as possible through a follow-up document. So first question I have is for you, Lynette. It says, what is CCAoA doing to help CCR&Rs and providers deal with the coronavirus?
Thanks, Kiyomi, and thank you for the question. We are providing technical assistance on emergency preparedness and response. This has been work Child Care Aware of America has been doing for a number of years. You can find our emergency preparedness resources online at childcareprepare.org. and we're also compiling the latest resources on the coronavirus and sharing them on our blog and in email updates. We did create a resource hub on our website with information for parents and providers and policymakers. You can find that as well at childcareaware.org. When you reach the website, you'll see a large banner that you can click on. We're also collecting stories from the field through this webinar on our website and our hotline, and sharing these stories importantly with policymakers to advocate for more assistance to help providers weather this crisis.
Thank you. I have a question for Julie. What resources does CCAoA have, additional sources in regards to emergency preparedness and planning?
Great question, and perfect timing right after Lynette. We have a great deal of resources. We have tips, tools. All of this is available on our website that Lynette mentioned, childcareprepared.org. You'll see that we cover all hazards, including pandemics. Additionally, we have available to our members an emergency preparedness training of trainers that we're able to deliver to your staff and to your trainers. And we're also able to provide coaching supplements and technical assistance focused on all hazards, preparedness, and planning.
Perfect. Thank you so much. I have a question for Steve. It says, how closely are you working with state government and your state administrator?
We have been working very closely. We've had 4 different conversations since Friday. We have a conversation at the end of each day to check on the progress that we've made. The state is looking at our parent resource and referral piece as a primary means to get information to emergency personnel to find childcare settings. We've also consulted with them on some of the plans for, I think someone mentioned this earlier, the possibility of drop-in supervised situations. So we've worked very closely. This has been a great opportunity to really see how partners, including people providing the services like the CCRCs and the funder, Maryland State Department of Education, are able to work together and be really effective.
Thank you, Steve. I have a question for Jessica. It says, how does the disease progress and when can I expect to see symptoms?
Sure. So given that this is a novel virus and a novel disease, we are sort of learning as we go. There's a lot of information coming out of China where the virus originated. So we do have a sense of how the disease progresses. The estimate is that symptoms will appear between 2 and 14 days after exposure, and on average it's around 5 days. The symptoms usually start with a fever followed by a dry cough, and that can progress into things like shortness of breath and pneumonia. When you have a mild form of the illness, that lasts about 14 days, but for those who develop a more severe form, that could be 3 to 6 weeks before symptoms resolve, and often involving hospitalization. And it's also important to note that symptoms can get worse very quickly. So it's important to have a plan in place for if you're a provider or if you're a staff member and you get very sick rapidly, who is going to care for kids? What is the plan for getting you to medical care? So just important to know that the symptoms can deteriorate quite quickly.
Thank you. I have a question for Lynette. And I think some of this was mentioned, but just wanted to reiterate this again. It says, does CCAoA have guidance on whether providers should close?
Thanks, Kiyomi. Thank you for the question. Yes, as Julie mentioned earlier, I believe it was Julie who mentioned earlier and shared a bit about an infographic on considerations for childcare closure. due to COVID-19. We adapted that from the CDC guidelines for school closures, and so I would recommend you taking a look at that infographic. I know that childcare providers all across the country, again, are at different places in making these decisions. Our intent is that this infographic can help you to understand the considerations that your program may have to make as you're trying to make this very tough decision. And again, you can find that information at childcareaware.org. Kiyomi, I also wanted just to say and put underline and bold the fact that this is all happening very quickly. So I would recommend for folks to continue to visit our website on a regular basis. We're consistently and constantly updating and tweaking and adding to our resources and information that we have on our website, and to the extent we possibly can, trying to push out that information through a lot of different vehicles, including social media, in addition to our website. So stay tuned to Child Care Aware of America. Again, because there is so much happening so quickly, hourly often, we are trying our best to try and be as up to date as possible. And as soon as we get effective information, we'll ensure updating that information on our website.
Thank you, Lynette. I have a question, and this can be for any of you who want to answer. It says, what are you hearing from child care providers and child care programs during this health emergency? This might be more appropriate for you, Steve.
Certainly. So how much time do we have left in the webinar? We're hearing quite a bit. So monitoring social media, it's amazing the kinds of things we're hearing. So we hear from providers a concern that the governor's order, which closed public schools in Maryland for 2 weeks, should have been extended to childcare, given that this is a public health emergency. Not everybody agrees with that, but that was some of the sentiment that was put there. There is confusion over service delivery, and confusion as well over when to accept children, when not to accept children. There is also some concern about the long-term effects of this. There are many programs, including ones that my grandchildren go to, where parents have withheld children out of concern, understandable concern, about keeping children out of groups and making sure that they're safe. And for the short term, most contracts have in place that parents need to continue to pay for that care. There is concern if this goes on for a much longer period of time, and if the governor actually does close child care center programs, that this will have a long-term effect on the market, on the supply and quality of child care. And the information that was shared both at this webinar as well as yesterday's webinar on some possible resources for child care providers to get short-term relief in the form of grants to help cover payroll, grants to help with operations. Those are all really important. But there's been no one single voice. Again, it's been highly varied. I think as I mentioned, there is a program in one of our jurisdictions that is reaching out to parents who may need care, emergency preparedness parents. So it's been all over the gamut. I think for the most part, providers are trying to help families, and at the same time, they're trying to be vigilant to make sure that children or staff aren't in care who can spread this.
Thank you, Steve.
I would just add, Kiyomi, that we're hearing a significant amount of something that Steve had mentioned earlier about, and I think Julia did as well, in regards to hospital workers, emergency responders, and so forth, who are trying to identify child care. We certainly look forward to, and given the number of attendees on this call, receiving any ideas or information or innovations that are happening in your communities as it relates to providing care for those emergency responders and getting creative about how we effectively do that as we're navigating through this crisis. Additionally, Steve mentioned several questions and concerns that providers have. We really are looking forward to collecting as much information as we can about the very real on-the-ground experiences and concerns that our early childhood educators are experiencing so that we can raise those up, not only in community solutions, but also as it relates to policy. So the extent to which we can hear from you would be incredibly helpful so that we can ensure we're sharing that information at the tables that we may be at.
Thanks, Lynette. I have a question that says, and this will be for all of you, and I'm sure that you all will answer this question, but are there any surprises or anything you were not expecting during this crisis that you want to share with this group?
Well, this is Steve Rohde. I'll venture something. I probably will regret saying this. I think the biggest surprise I had was the lack of a national response. It's been fascinating to watch governors of states step up and take action and recognize this public health emergency. I would hope one of the lessons learned long-term is the role of the federal government in something like this, particularly when it goes beyond a state's borders, how important it is that the government have set up policies and procedures and resources so that we might not be facing the same thing that we're facing now. I think that was the biggest surprise for me.
This is Jessica. I would say my biggest surprise, and maybe sadly it's the least surprising thing, is the amount of disinformation and wrong information that is out there about this virus and about how to protect yourselves. I implore everyone to go to the CDC, go to the World Health Organization, go to your state and local health departments. Those are the sources for reliable, science-based, public health-based recommendations and information about how to keep you and your family and your community safe. Please don't go to the internet on your own or to social media for answers about this. Go to the reliable sources.
Thank you so much. And with that, I'm going to turn this over to Lynette to close us out.
Terrific. Thanks so much. And thank you so much to our presenters, Julie, Jessica, and Steve, and to everyone who shared their questions and concerns. I encourage all of you to tell us about your experience preparing for and dealing with the coronavirus. Again, we have an online submission form at childcareaware.org. We'll also continue to update the Coronavirus Resource Hub on our website with the latest information and resources for parents and providers. On behalf of the entire staff of Child Care Aware of America, I hope you, your families, and the families you serve stay safe and healthy, and we stand ready to help you during this challenging time. Thank you so much for joining us today, and greatly appreciate your commitment to children, families, and communities.
Thank you, Lynette.